I'm Harrison Kaingu, the CEO of Kinondo Kwetu Hospital. I want to thank you, Vaccin-nu, for your contribution towards the healthcare, and not only healthcare, but quality healthcare. And this is not easy for those 80% of the villagers who cannot afford to pay for healthcare in this area. We are now having over 110 births every month. When we established this, tuberculosis was around 40% of the population here had TBC. And now that has come to around 6%. It was alarming because almost 60% of the kids had worms in their in their stomach. So when I went further to analyze the water, it was unfit for human consumption with a lot of coliforms, bacteria. It was just unsuitable. What we are seeing now is the aftermath of the COVID, the long, that whole year of uncertainties, and people could not access healthcare, and many stayed indoors. And those who that year needed, like surgeries and care, now are coming up, and we have almost 12 months backlog of patients who really need help. Remember, one contribution takes care of around an average of 6 people in the family. So in the 50, you have helped over 300 families or people in that family, at around 300 persons. Those families are very happy now that they can access healthcare in this facility. We were torn between looking at the losses that we're making and giving care to the people. Now that we have this donation for the insurance to these families, it has been better. We are corruption-free, hospital, and that has enabled us to come this far. We are dedicated to use that shilling or that dollar to better the lives of the people around here, and we make maximum use of that dollar that is contributed, because someone somewhere has to sacrifice. Yes, we used to have vaccines being done like twice a week. And it's always, with the women here, they look forward to that special day when they're bringing their babies to be vaccinated. And in those days, they really, dress up so well, and it's they gather up in groups and friends to just take their babies for immunization. And it is in that day when after immunization, they go to the market and buy some pleasantries and go back home. So it's a really a very important day when the baby is being immunized. Now we have made it daily because of the number of babies to be immunized. We have lots and lots of babies to be immunized. We are immunizing around now 30 to 40 babies every day. It has now helped this community in terms of the health indicators, and we are having 100% to a fully immunized community. That's our target, and we are almost there. So we are happy that we have this support, and in the future, if vaccines are there and we tackle the water issues and antibiotics, then we will have a healthy community altogether. Thank you, Vaccin-nu, for your contribution.